I'm every student in USYC. I'm going to present my topic, carcinogens. It's like the contents of my lecture will be first I'll talk about carcinogens, definition and classification of carcinogens, chemical carcinogens, radiation carcinogens, viral carcinogens, and bacterial carcinogens. After finishing about carcinogens, I will be talking about carcinogenesis, the process of formation of cancer cells and how it spreads in our body. And after that, I will talk about most common and most useful topic, smoking and cancer. After that, I will be talking about cooking and cancer. Okay, talking about the definition of carcinogen, any substance or agent that is directly or indirectly involved in causing cancer or has an ability to do so. I think it's pretty clear. Any substances, okay, any substance we know that can cause cancer is called carcinogen. Okay, now the carcinogens damage the genome and disturb the cellular metabolic processes. Now, a carcinogen can alter a cell's DNA. As you all know, DNA is the main material of our body. It is situated in the nucleus, and it goes for the all the cells of our body. It goes for the metabolism, respiration, reproduction. Everything is coded by DNA. And these carcinogens, they change or damage the structure or the contents of the DNA, so that our whole body will function differently. This is a small picture I have kept here. It shows that the DNA was normal before, and after exposure to the carcinogens like UV rays and smoking, now the DNA has become, it has been mutated. You can see in the picture, it is slightly changed. It is the DNA mutation. Next one. Now, a carcinogen may be initiator or it may be a promoter. Initiator are those which initiates the process of carcinogenesis, and promoter are those which encourage the growth in already initiated cell damage. Now, the classification of carcinogens. Now, the International Agency for Cancer Research, IARC, has classified carcinogens into 5 groups on the basis of their risks, on the basis of their property of carcinogenicity. It is classified into 5 groups. They are Group 1. Group 1 are carcinogenic to humans. This Group 1, those carcinogens have been proved to be carcinogenic in experimental animals. These are kept in Group 1. Group 2A, they are probably carcinogenic to human beings. It means that there is strong evidence, but it's not 100% proved, so that is kept in Group 2A. And Group 2B, they are possibly carcinogenic to human. It means that there are some evidences, but it is also not proved in practical animals. Now Group C means these are unclassifiable as to carcinogenicity, and Group D are probably not carcinogenic. Now, there are about 111 agents. They are placed in Group 1. It means that the 111 carcinogens have been proved to cause cancer in human beings. And in the same way, there are 66 agents are grouped in Group 2A, 285 in 2B, 505 in Group 3, and 1 agent in Group 4. Now, this is another classification of carcinogens. It is just a physical classification, and carcinogens are classified into chemical carcinogens, radiation carcinogens, viral and bacterial carcinogens. And chemical carcinogens are also divided into directly acting and indirectly acting chemical carcinogens. Next slide, please. Now, directly acting chemical carcinogens. These are those chemical carcinogens which require no metabolic conversion. They are themselves carcinogenic. The examples of directly acting chemical carcinogens are anti-cancer drugs like azithromycin, chlorambucil, cisplatin, cyclophosphamide, cyclosporin A and tamoxifen. You might be wondering, these are anti-cancer drugs, right? But these are also carcinogens. These are used in the treatment of one type of cancer, but they have the ability to cause another type of cancer. Okay? Next please. Now, patient receiving such therapy are at increased risk of developing another type of cancer, like leukemia. And next example is nitrosamine and benzyl chloride. These are the directly acting chemical carcinogens. Now, indirectly acting chemical carcinogens, they require metabolic activation in our body to become carcinogenic. And the examples are aromatic hydrocarbons. These are present in cigarette smoke and they can cause lung cancer. And azodyes, it is a dye used in rubber industries and it can cause bladder cancer in exposed workers. Asbestos, it predisposes the persons to lung cancer and mesothelioma. Next please. Now, acrylamide, it is also indirectly acting chemical carcinogens. It is generated in fried and overeaten carbohydrate foods like French fries and potato chips. And these are also found in cigarettes. And they can cause many types of cancer, like cancer of the liver, kidney, intestine, ovary, and endometrium. Now, aflatoxin B, I should not say anything about this. I guess it has been already given by another speaker. Now, estrogen hormone. Estrogen hormone also increases the risk of endometrial and breast carcinoma. Acetaldehyde, these are found in alcohol and cigarettes, and these are also used as flavoring agents and used in fragrances and production of many chemicals. And these chemicals can cause the cancer of mesothelioma, larynx, pancreas, fibroadenoma of breast, leukemia, and lymphoma. Now I will talk about radiation carcinogens. The sources of radiation carcinogens are UV rays of sunlight, X-rays, nuclear radiation, and therapeutic irradiations. Now the radiations have mutagenic effects. Mutagenic effect means it can cause mutation of DNA. Now, how does it cause mutagenic effects? It can cause chromosomal breakage, translocations, and point mutations. Now, UV rays of sunlight. Okay, sunlight is very essential for our body, but it can also be act as a carcinogen. Like it can cause melanoma, squamous cell carcinoma, and basal cell carcinoma. Now it is capable of DNA damage. With extensive sunlight exposure, the DNA repair mechanism is destroyed. Okay? And since the DNA repair mechanisms are destroyed, skin cancer can cause. It can cause skin cancer. Now, this UV rays of sunlight can also cause mutation in TP53 gene. I think you all are familiar about this gene. Next please. Now this is a picture. A girl is enjoying extensive sunlight, okay, but she is unaware that she can manifest as basal cell carcinoma of the skin. Now the ionizing radiations. Now how these ionizing radiations acts as carcinogens. Now we have several examples that this miners of radioactive elements, they have the increased risk of lung cancer. It has been proved in many surveys that they are in increased risk of cancer. Similarly, the survivors of the atom bomb dropped on Hiroshima and Nagasaki showed an increase evidence of leukemia even after many years. So that it shows that ionizing radiation, they are carcinogenic. And another common example is that the therapeutic radiation of male in children is associated with the development of thyroid cancer. Okay. In case of hypothyroidism, the treatment is radiation. Okay. But later the patient may manifest as thyroid carcinoma. The carcinogenic effect of UV rays lies in the ability to damage DNA, whereas the carcinogenicity of ionizing radiation lies in the ability to induce mutation. Now, I'll talk about viral oncogenes. There are several viruses which have the capability of causing cancer. For example, this human T-cell leukemia virus, they can cause T-cell lymphoma. And human papillomavirus, it is more common. It can cause the cancer of cervix, anogenital region, mouth and larynx. Next. Now, Epstein-Barr virus. This virus, it is a group in this virus. Okay, it can cause Burkitt lymphoma, Hodgkin's disease, and nasopharyngeal carcinoma. This is the picture of Burkitt lymphoma, child from Africa is suffering from Burkitt lymphoma. Next, please. And this is a picture of nasopharyngeal tumor. Now, hepatitis B virus. I think we are familiar with this virus. Okay. The presence, the chronic presence of hepatitis B, they are like more than 200 times increased risk of getting liver carcinoma. This is a picture of liver cancer. Next, please. And here I have kept one picture. The patients with chronic hepatitis, they have high chances of getting liver cirrhosis. And the patients of liver cirrhosis, they have high chances of getting liver cancer. Now, bacterial oncogenes. This Helicobacter pylori, this bacteria, it is mostly associated with peptic ulcer in stomach and intestine, but it can also cause gastric carcinoma and mucosal associated with brain tumor. This is a picture of gastric carcinoma. One is endoscopic picture and one is just a good picture. Now, I'll talk something about carcinogenesis. Carcinogens and carcinogenesis is different. I think you are listening to me carefully. Please. Carcinogenesis is the process of formation of cancer cells. Okay. Now we are talking about carcinogens. Now, how does the carcinogenesis, the process evolves? I'll talk briefly about this. This carcinogenesis is a multi-step process. Okay. It doesn't occur in just one step. It is a multi-step process occurring at both phenotypic and genotypic level. Now we start with the genetic damage. It starts with the DNA mutation. Now these are the carcinogens. We have already talked about that. So do next. Now this picture I have showed in the before slide also. See, the DNA is normal in this case. But after the exposure of carcinogens, the DNA damage has occurred. There is DNA mutation, and in this picture I have shown that when the DNA is mutated, there are several repair genes in our body. There are several genes in our body which tries to repair the damaged DNA, and in some cases the repair genes are also mutated. In such cases, cancer can occur. In our body, if the repair genes are functional, if the immunosuppressor genes are functional, then a person will not suffer from cancer. But if the person has a mutated repair genes, mutated immunosuppressor genes, then only cancer cell will develop. So that I told you that it is a multi-step process. Next please. Now, when a single cell with genetic damage, if there is a genetic damage, our body always tries to repair the DNA. And if there is a failure of DNA repair, then there are some genes called apoptosis gene. Okay, it tries to kill the cell itself. Apoptosis is also called programmed cell death. Now it tries to kill the cell, and if there is a failure of this apoptosis gene, then there occurs the neoplastic proliferation and formation of tumor occurs. Now, what are the targets of genetic damage? There are 4 important genes which are the targets of genetic damage. Primary oncogenes, and there are 3 other genes. Okay, there are 4 types of genes. Oncogenes are those genes which causes the formation of tumor, and there are 3 genes. These 3 green genes, they are useful to our body because they are trying to suppress the formation of cancer. See, if this proto-oncogene is mutated, then it becomes oncogene. Oncogenes are those genes which causes the formation of cancer cells. But other 3 genes are preventing from formation of cancer. DNA repair genes. If the DNA repair gene fails, then there are genes regulating apoptosis, and there are also tumor suppressor genes. And if in case all the 4 genes are mutated, then only cancer formation occurs. Cancer formation is a multi-step process. If all these genes are not working, or they are mutated, or they are disrupted, then only cancer occurs. Next please. Now, what are tumor suppressor genes? The name itself suggests that it is a tumor suppressor gene. They apply brakes on the cell proliferation. Now, if the tumor suppressor genes are normal, the cancer cell, the cancer formation, carcinogenesis cannot occur. But if the mutation has disrupted the tumor suppressor genes, then the cell becomes uncontrolled. Okay? There is no brakes. There is no brakes, so that the cell can proliferate, uncontrolled proliferation occurs, so that tumor formation may occur. Okay? The examples are P53, retinoblastoma gene, TGF, and APC. These are the examples of tumor suppressor genes. Now, this is a picture where showing the formation of neoplasm. Okay, there is a normal cell, and the normal cell is exposed to the carcinogens like chemical carcinogens, radiation carcinogens, and viral carcinogens. Okay, and they occur the DNA damage. Now, if the DNA repair is successful, then the cell will again move towards the normal. Okay, it will become normal again. But if there is failure of DNA repair, then the whole genome will be mutated. Now, since the genome is mutated, there occurs the activation of proto-oncogenes will be mutated into oncogenes. The oncogene is activated, and then the other genes like tumor suppressor genes and genes regulating apoptosis, they are mutated. So the helpful genes are mutated, and the proto-oncogene is converted to oncogene. So that these 3 steps occur, then there occurs the formation of malignant neoplasm. Next please. Now this is the same picture. There are 2 cells. Okay, one cell is normal cell. One cell has loss of 253 genes. Then in case of normal cell, the DNA, although DNA damage has occurred, the repair will be successful. Since the repair is successful, it will again turn into normal cell. But in this site, in this case, there is no P-represent gene, so that the DNA cannot be repaired. Since it cannot be repaired, then the uncontrolled proliferation occurs, forming malignant tumor. Next please. Now, smoking and cancer. Everyone know that we all say that smoking is injurious to health, but we might not be knowing why it is injurious, what are the consequences. I just want to focus on this topic. This is very important. Smoking accounts for 30% of all cancer deaths and 87% of lung cancer deaths. Now, these are the list of diseases. These are the list of cancers caused by smoking. CA of carcinoma of lung, larynx, esophagus, pharynx, oral cavity, pancreas, bladder, kidney, cervix, stomach, and bone marrow. Next please. And these are the percentage of cancer caused by smoking. 78% of lung cancer, it is most common, but smoking can also cause other type of cancer. Next please. Now, these are some data from survey. The smoke emerging from a cigarette is an aerosol containing about 10 to the power 10 particles per ml. Okay, we see just one smoke, but one stick of smoke contains 10 to the power 10 particles per ml. And it contains 4,800 compounds, okay? And around 70 of them are carcinogenic. It has been classified by International Agency of Research Council, and it has said that it contains 70 of them are carcinogenic. They fall under group 1. Group 1 means they are proven to be carcinogenic. And in a survey, the risk of getting lung cancer are 0.2%.